afternoon out there, and welcome to Trinity Behavioral Care, the Art of Recovery podcast. I am Ebony Manning, your host here, and today we have Ms. Regina Floyd. She's also our nurse practitioner at Trinity Behavioral Care, and we're going to talk about her role that she plays at Trinity, all three facilities, and also share a story, a personal story and transparent story of lived experience with breast cancer. So, good afternoon, Miss Regina.
Good afternoon, Ebony.
How are you?
I'm good.
It's a pleasure to finally have a sit down with you.
It is. It's exciting. I'm happy to be here.
All right. I appreciate it. So we're going to get in a little bit about what is your role at Trinity as a nurse practitioner?
Okay. As the nurse practitioner, I am the provider for all of our medication-assisted treatment patients. So those are ones who come in with some type of substance abuse disorder.
Okay.
Not all of them can be treated with medications, but those that can, I see. So like opiate abuse or alcohol disorders, there are medications that are FDA approved that they can receive that will assist them with their recovery.
Okay. So that's a different look and a different take. So, and that, I guess, partners and aligns with counseling services, but they see you to help with those active addictions with the FDA approved medicines, correct?
So the medications are just a part of their recovery.
Okay.
So medications will assist them with their immediate withdrawals or cravings or that desire to use. So the medications come in to try to decrease that amount. And then along with the counseling, be it individual or group, the two together helps to reach recovery for them. So it's a way of giving them medication so that they're not going out there and buying the illicit substances, not knowing what it is they're receiving, but they can get a prescribed medicine that will help fight that craving for that addiction. And then along with the counseling to kind of help basically reset your mind and your thoughts.
Wow.
To where we don't go out there and buy it and use it.
Yes, ma'am. Okay. And have you found that works?
The majority, it does. There's a different substances that we use, different medicines that we use that range from Suboxone, Subutex, Vivitrol.
Okay.
And there are different parts of each one of those. The main thing is getting them in, getting them compliant with taking the medications and staying on the medications.
Yeah.
And then we get to a point to where we get them stable, get them in maintenance, and then we start titrating them down.
Gotcha.
Even though they may come on the medications, it's not a lifelong sentence. It's not like trading one substance for another. It's actually to get you to something that is approved and safe and known to help.
And then I guess prior health issues as well you have to look into, correct?
Right. That plays a part. The initial visit, they get a physical, and it's not an extensive physical, but we do a brief physical on their medical history, surgical history, and allergies. And then it's all based on individual. No two people get the exact same treatment.
Wow.
Even though they may have the same substance choice, it depends on what their medical history shows. There are some that may not be eligible to receive any of our medications depending on their health history.
Okay.
And if that's the case, then we would refer to a higher level of care.
Okay. Yeah. All right. Do you feel that it's important to have a personal relationship or to be able to connect with them? Because 1 week could be okay. The next week could be, a lot all over, you know.
And you are correct. We do have to, I try to develop a relationship with each one of my patients, because if they don't trust you, they're not going to open up to you.
Wow.
And if they can't open up, and I understand, this week, like you said, may be a good week.
Yeah.
But next week was a little stressful and they may have ended up lapsing or having some other issues. And they may not always connect with me, but they may connect with a counselor or a peer support person. So it's important that at least someone in their treatment plan they can connect to and trust as they'll open up to.
Yeah.
And it's like an interdisciplinary team. We talk with one another, we work together, and all of it for, in reaching that recovery status where you're going.
Yes, ma'am. And that's you're in all three locations, correct?
Correct. Yes. I cover Dillon and Marion counties twice a week, and Marlborough County is only once a week.
Okay.
And so it's new.
Yes.
That just started. The Dillon office started in August. I think the Marlborough was in February of
Yes,
this year. So the addition of the other two locations have been a little challenging,
Yeah.
but we're making it work.
It's a part of the future, the long-term plan,
Right.
and not just a short-term
Just
plan.
right. I agree with you. It's I think having one provider in all three locations works to where we're all doing same thing,
Same thing.
but
Yeah.
yet a little different.
Yeah.
So it's not like, at some point, when I was in the Marion office and they may have been seen in a different office, then they would say, well, I can do XYZ here. So, but now we're all under that same umbrella and we kind of work exactly the same way. I mean, depending, of course, on the patient.
Yes, ma'am.
So I think it's a positive thing being in all three locations.
Yes, I think so too. And I'm glad that we have this opportunity to have the conversation so that the community can also understand and know your role, and also the services, another part of the resource that we provide here at Trinity. So I thank you for that.
Thank you.
So now we're going to transition a little bit. I would like to hear breast cancer awareness from your perspective as a nurse, but also being transparent in your personal survival story.
Okay.
Can we talk about that?
Yeah, sure we can. We can. My breast cancer October is near and dear to me because of that. It brings more awareness to breast cancer. Breast cancer hit me personally twice. First time was with my sister. She was, 37, I think it was, when she had a spot on her breast that looked like a bruise. Her physician thought it was just some type of infection or some type of bruising from the underwire bra. Started her on an antibiotic, which made the spot look like an orange dimple.
Wow.
She and I didn't know it at the time. This is 20 plus years ago, that was a sign of an aggressive form of breast cancer.
Wow.
So when she went back to her doctor, she was diagnosed with breast cancer. She began her treatments, which included radiation, chemotherapy, and surgery. She had a mastectomy. However, in less than a year, she died from breast cancer. It was that extensive. So she was diagnosed at 37, had a birthday, and died she died before her 38th birthday.
Wow.
So that kind of made me more aware, and it also put me at that high risk stage. So I began having mammograms at the age of 35. Which was a good thing for me, and we learned that we educated ourselves with that because we didn't have any family history prior to that. So I began doing mammograms at the age of 35 until I missed one. I missed one January 2007. I did not have that mammogram. And when I went back in 2008, I had found a lump, and I had my mammogram. And when they did the mammogram, and then they said, we're going to schedule you for an ultrasound, and then we're going to do a biopsy while you're here, hairs on the back of the neck stood up because we kind of like, what are you finding?
Yeah.
And it was breast cancer. And when I was diagnosed, I was a stage 4 breast cancer.
Wow.
Yes. I think because of where I was, I got the aggressive treatment I needed. I was living in Texas at the time.
Okay.
So I started with, I don't know the order, I don't remember, but it was chemo, radiation, and then I had the mastectomy as well. And I have now been 16 years cancer-free.
Wow.
So,
and what a story. I don't think is publicized enough or talked about enough that even at 35,
right,
we have to be tested.
Right. But the guidelines from the American Cancer Society state testing starts at 40, in which you have that family history.
Yes.
And because of my family history, 35. But I do recommend that every man or woman, yes, men can get breast cancer, do breast exams. And and know your body. And if something looks different, feels different, if there's any type of drainage or anything, see your provider.
Yes.
It's very important that you know your body because you're going to be the only one can tell if something's not right.
And the fact that you said you skipped 1 year.
1 year.
And when you went back, it was already at a stage 4. So you had to jump right into it.
Exactly.
What was that like? I mean, emotionally, and then you still had just recently lost your sister.
Right.
So emotionally and as a survivor, how do you get through it?
I always tell people what got me through that whole situation and still gets me through today is my faith. I had a praying mama. Yes.
Yes.
Praying sister. I had one older sister in my whole congregation in Texas and here in South Carolina.
Yes, ma'am.
So we did a lot of prayer, a lot of faith that we were going to get through this. And like I said, I think the Texas location, not knocking anything here in South Carolina, but it's just where I was at that time.
You had the resources
for what I needed.
Yes.
And I feel that helped me a lot. Now, my sister went to one of the best treatment centers here. It's just that she had that aggressive type of cancer.
Yes, ma'am.
And it was even when our doctors saw her, and then I was still working in healthcare then as well. One of my doctors told me, pull me to the side to say, hey, that type is very aggressive and outcome is not always favorable. So we prepared ourselves, but we were always still with faith that we're going to get through this. And I did the same thing then. It was very hard on my mother thinking she was going to lose another child. So we still do. I did testing, still did my mammograms up until a few years ago when he finally said, okay, you don't need them anymore. I still check.
Yes, ma'am. You're right.
And I tell my story as much as I can.
Yes, ma'am.
Because you never know who might be going through something that needs to hear that as well. So I do, and I encourage anybody else who's going through not just breast cancer, but any type of survival story.
Yes, ma'am.
Share that story because it can help somebody.
Yeah, most definitely. Most definitely. And again, recovery is a recovery. It doesn't have a name. It doesn't have an expiration date. It doesn't have a time or a timestamp. It's just what it is. And through life experiences and life journey, we run into things.
Right.
But at the end of the day, you choose to push forward. You choose to move forward. You choose to, like you said, 16 years, we're still bringing awareness. We're still having the conversation. And that's what it's all about. Because like you just said, it doesn't matter.
Right.
It doesn't matter what we know, but everybody knows someone.
Right.
That's been through that issue or this or that. But this is what the art of recovery is about.
Right. It is. And it works, like you said, full fold. It's not just on addiction. It works for anything. You're still going through that recovery phase with whatever life circumstance you're going through at that time.
And most definitely. Like you said, with our faith, we trust in God, but sometimes we have to speak those things.
That's exactly right.
And
don't be afraid to hold it in because you're thinking you're going to be judged regardless of what it is you're going through. Because like I said, you never know when you may meet that person who's going through similar that you can help them and they in turn could help you. So just be open, be honest, and because holding it in, then that's going to emotionally drain you and drag you. So you've got to be able to share that. And if you don't feel comfortable sharing it with someone, outside of your immediate circle, you need that one somebody. I think it's my nephew that calls it your go-to person. You've got to have that go-to person. And I have several. So my best friend is the bomb. I can call her with anything. She's going to listen and she's going to tell me whether I'm right or wrong. So you need that person who's going to be open and honest with you.
That's so true.
You got to feel comfortable with them so that you don't hold that all in and make a situation worse. And
that was a great point about finding that go-to person and just let it go.
Right.
Let it go, let it out. And just know that resources are here.
They are here and available. And if, even especially in recovery, they need that go-to person. Someone who's going to be on that positive track with them and support them to go to recovery. Because you're going to always have those friends in the corner that want you with them. They're not ready. Find you that positive person that's going to help walk with you through this recovery.
Yes, that number one fan, that one is always going to be positive, going to cheer you on, and going to make you smile.
Right.
Sometimes it takes a smile or just even a hug.
Right. And that's it. There was a video I think I saw once that said 8 minutes is all it takes. That 8 minutes are 8 seconds to call and just say, hey, how you doing? And that's all it takes. That's all it takes. Open it up. So just remember that it doesn't take a lot. You don't have to sit on the phone for hours. But if you're available, then you can. But it only takes that initial step to let somebody know that you're there and you care.
Yes. I thank you for that. No, very transparent. Very transparent. You guys out there, I hope this has been a blessing to you, encouraging to you that, find that go-to person. be able to share, let it out, not hold it in, and know that we're in this together. Together we can choose a better life, and together we want to be able to live free, live lovely, live in joy, peace, and happiness.
Yeah.
And stay tuned. See what we got coming up next. I'm glad you was able to join us today. Looking forward to seeing you again. And thanks again, Miss Regina.
You are more than welcome.
I'm sure I'll bring you back for something, okay?
Of course.
We'll come up with something else.
Thank you. It was a
All right.
pleasure.
Take care, you guys. God bless you and have a blessed day.